rather eclectic. You know, I think I have a mixed bag of leadership characteristics and styles. I hope it's situational. I hope that I lead in terms of what the situation calls for. And that means that I know how to follow.
Okay.
And I know when to follow. And that I practice that, of how to step out of the way so others can take over. And learn how to be comfortable with that, and not just comfortable, but to embrace that, to celebrate that, to learn how to advocate for their leadership. So I think it's eclectic. And I have some very clear guidelines. I can be delayed but not defeated. That means that I'll keep trying every way that I possibly can, as long as I have breath. And I don't consider something that makes me pause a defeat. I just consider a pause. It's just a way that means I've got to do something differently, or not at that time. I believe in it's a cinch by the inch and it's hard by the yard, and that means that sometimes you have to inch your way along and learn how to celebrate every inch of the way, and that sometimes you can't do it all in one big step. Life is like that. I believe in celebrating leadership, and that there's a leader in everybody. The question is your timing, the intensity, or the dominant piece of you. And I think the dominant piece of me is leading. But you can't lead unless you follow. I was raised by my great-grandmother, and my granny was a healer. She was one of the town people who took care of people, who helped people recover from heart attacks and got them riding bikes and wrapped their legs, keep them from swelling, and fed everybody, fed children, took people in. He was that kind of person, and to me that was a nurse. It was kind of like a journey. I was at the bedside for a while, but then I was a faculty member at the University of Cincinnati, and I was a director of nursing at the hospital there, at the University Hospital, for about 6 years. Then I was dean of nursing at North Carolina A&T. So I hadn't been a bedside nurse for about 10 or 15 years when I became president of A&A. But I remember clearly deciding when I was going to move away from bedside nursing. I was a psych nurse. I decided that I was a very good psych nurse. Patients got better. I mean, that was my measurement tool. And I said, and I like the way I do things. I like the fact that I feel I treat people with a lot of respect, includes the staff, it's not just the patients, but it's everybody. Very inclusive model. And I said, if you're doing all this so well, then you need to be helping other people learn how to do it and learn how to be more inclusive. To whom much is given, much is required. And I got it. I understood that I had to be on the bigger scene. And that, I'm very good at this, so I believe that God gives you, moves you, shapes you, puts you where you need to be. And it just seemed like that I was called to do that. That was part of my charge. It's part of why I was born. I was born to do more than just a few things. Yeah. It was a great job. It had never been held by a nurse. Usually lawyers occupied that post. And it was one of those all over the waterfront jobs. I mean, I had everything from international health to mad cow disease, which was mad sheep disease, to flooding in North Carolina, to mental health, children's mental health, suicide prevention, AIDS, and prevention and health care. I mean, it was absolutely fantastic. Just everything. And I was the one to coordinate, bring people together, which was very easy to do. I've been a clinical nurse specialist, and basically that's what we do as a CNS. So my job was to have one message come out from these incredibly brilliant people. And being a clinical nurse specialist, I could just use the skills that I'd learned about working with medical oncology and surgical oncology. You got to sit them down and bring them together and get them to understand that it's not about them, it's about the patient. It's not about the National Institutes of Health or the CDC, it's about the country. And that's what I did. I really don't know if there's one thing, Sharon. For me, it's about continuous process of giving, a continuous process of being available to be used, a continuous process of putting forth a message of inclusion and collaboration and keeping it patient-centered. And I'm not sure that it's because I put my hands on it that it happens. It's because there are a lot of hands on it, and my hand is just one of those that helps it to happen. There are some things I've done that others have not done, you know. It's been really exciting and I like a lot. For example, I put together a consultation department when I worked as the director of nursing. The consultation department had clinical nurse specialists in it, and they consulted internally and externally. So the hospital had them as internal consultants to all the units, but we also consulted with industry and corporations about medical equipment and supplies, and we did research and translated that into patient care issues. It was the first one of its type in the country, and it made money, and it was a revenue-producing enterprise. And I loved doing it because it made a difference in the lives of patients. And it made a difference for nursing to come out of the woodwork and be acknowledged as a major player and contributor. And a trendsetter. We were actually setting up something that no one had done. I enjoy doing that kind of stuff, but if you look closely at it, I'm leading it, but I've got brilliant people working with me. Some actually absolutely brilliant people working with me. And when I went over to England, I loved that. I think it meant a lot to healthcare globally that I was that involved and that I was accepted. I also worked I was the vice president of the European Federation for Nurses. And I think that opportunity for the United States and for America and for an African American to be of that healthcare delivery system at one of the most senior level positions in the system was very important, and it had a lot to do with the UK and with the world, but it also had a lot to do with the US, because I know when I came back from that, because no one has ever done that, that's considered to be unusual. When I get to do something that hasn't been done, I feel honored, I feel happy to do it, and glad that I was able to stretch out and be there. You're always giving something, even when you're receiving.